Picture this. It is a Saturday morning in January, and you are standing in your driveway holding a snow shovel. The first real storm of the season came through overnight, and there are about 8 inches of heavy wet snow between your car and the road. You are 56 years old, reasonably healthy as far as you know, and you have shoveled this driveway 100 times. You take a breath of cold air, you dig in, and you start throwing snow. 10 minutes in, you feel something. Not pain exactly, more like a pressure, a fullness in the center of your chest, as if someone has placed a hand flat against your sternum and started leaning. You stop, you straighten up, and you decide it is probably nothing. Maybe you pulled a muscle. Maybe it is the breakfast burrito. You are a human being, and human beings are remarkably committed to assuming everything is heartburn. It is not heartburn. Hello, I am Dr. Morbid, and this is a case file. Today, we are examining myocardial infarction, the event you know as a heart attack. It kills roughly 700,000 Americans in some form of cardiovascular event every year. It is the leading cause of death on this planet, and despite that impressive resume, most people cannot accurately describe what one actually feels like. Hollywood has taught you that a heart attack is a man clutching his chest and collapsing dramatically. The reality is quieter, slower, and considerably easier to ignore, which is exactly why so many people ignore it until ignoring it stops being an option. Let us open the file. First, the medical setup so you understand what is happening under the hood. Your heart is a muscle, and like every muscle, it needs its own blood supply. That supply comes from the coronary arteries, small vessels that wrap around the outside of the heart like a crown, which is where the name comes from. Over decades, cholesterol, fat, calcium, and inflammatory debris build up inside these arteries in deposits called plaque. This is atherosclerosis, and it develops silently. You do not feel plaque forming. There is no notification. Then one day, a plaque ruptures. The cap covering it tears open. Your blood mistakes this for an injury, and your clotting system does exactly what it was designed to do. It forms a clot. The problem is that this clot forms inside an artery feeding your heart muscle, and within minutes, it can grow large enough to block the vessel completely. Downstream of that blockage, heart muscle is now receiving no oxygen. Heart muscle without oxygen begins to die, and it begins to die on a schedule. Irreversible cell death starts roughly 20 to 30 minutes after complete blockage, and it spreads outward hour by hour. Cardiologists have a saying, time is muscle. Every minute of delay costs you heart tissue you will never get back. Now, back to your driveway. Stage 1, the pressure. That sensation in the center of your chest is not going away. It is a squeezing, a heaviness, a tightness. Patients describe it as an elephant sitting on the chest, or a fist closing around the heart, or a band being tightened. What it usually is not, and this matters, is sharp stabbing pain. Your heart cannot feel pain the way your skin does. It has no fine sensory wiring for that. What it can produce is this deep, crushing, poorly located pressure, the kind of discomfort you cannot point to with one finger. You lean on your shovel. You tell yourself it will pass. Sometimes it eases briefly when you rest, and this little intermission convinces thousands of people every year that they are fine. You are not fine. The clot is still there, and it is still growing. Stage 2. The spread. Now the discomfort begins to travel. It creeps into your left arm, a heavy aching sensation running down toward the elbow. It climbs into your jaw, and it may reach your neck, your back, between your shoulder blades. This is called referred pain, and the explanation is a wiring problem. The nerves carrying distress signals from your heart enter your spinal cord at the same levels as the nerves from your arm, your jaw, and your upper back. Your brain has never received a complaint from your heart before, so when the signal arrives, it misreads the return address. It assumes the problem is in your arm, because your arm sends signals all the time and your heart never does. Your brain in this moment is confidently wrong, which is a habit brains have. If you are a woman, the presentation may be even less obvious. Women more often experience nausea, unusual fatigue, shortness of breath, or jaw and back discomfort without the classic chest pressure at all, which is one reason women are more likely to have their heart attacks dismissed, sometimes by doctors and often by themselves. Stage 3. The cascade. Your body has now figured out that something is seriously wrong, even if you have not, and it responds by dumping adrenaline into your bloodstream. You break out in a cold sweat. Not the warm sweat of shoveling snow, but a clammy, drenching sweat that soaks your shirt while your skin turns pale and gray. Diaphoresis in the clinical language. You feel nauseated. You might vomit into the snowbank, which at least is convenient for cleanup. You feel short of breath because your damaged heart is struggling to pump effectively and pressure is backing up into the blood vessels of your lungs. And then something stranger arrives, a feeling of dread. Not anxiety about the situation, but a deep, primal certainty that something is ending. Medicine has a name for this. Angor anomie, the anguish of the soul, a documented clinical sign in which the patient reports a sense of impending doom. When a patient tells an emergency physician that they feel like they are going to die, experienced physicians take that statement very seriously because the body is sometimes a better diagnostician than its owner. Stage 4, the collapse. You have now spent perhaps 30 or 40 minutes negotiating with your own heart, and heart muscle has been dying the entire time. Dying heart muscle has a second problem beyond the mechanical one. It is electrically unstable. Your heartbeat is coordinated by an electrical signal that sweeps through the muscle in an orderly wave, and injured, oxygen-starved tissue disrupts that wave. It creates short circuits. And at some point, without warning, the orderly rhythm of your heart can dissolve into ventricular fibrillation, a state in which the heart muscle stops beating and starts quivering like a bag of writhing worms, pumping no blood at all. When that happens, blood flow to your brain stops. You have roughly 10 seconds of consciousness remaining. Your vision tunnels, your knees fold, and you go down into the snow. This is sudden cardiac arrest. And it is how the majority of heart attack deaths actually happen, many of them within the first hour, before the ambulance, before the hospital, before anyone even knows there is a problem. From the moment you hit the ground, brain damage begins within minutes. Without CPR and without a defibrillator, survival falls by roughly 10% for every minute that passes. And this is the point where, medically, the story ends for you. You are lying in your driveway, the shovel is somewhere nearby, and the snow, for the record, does not care. But you are alive and watching this video, so let us step out of your body and talk about someone this actually happened to. His name was Tim Russert. If you followed American news in the 90s and 2000s, you knew his face. He was the host of Meet the Press on NBC, one of the most respected political journalists in the country, and by every account, a warm and generous man. He was 58 years old, and here is what makes his case worth studying. Tim Russert knew he had coronary artery disease. It had been diagnosed, it was asymptomatic, and he was doing what he was supposed to do. He was on medication, he was exercising, he was under a physician's care. In late April of 2008, he took a cardiac stress test and performed well. Less than 2 months later, on June 13, 2008, he was at the NBC News Bureau in Washington recording voiceovers for that Sunday's show when he collapsed without warning. A colleague started CPR. Paramedics arrived and shocked his heart multiple times. It never restarted. The autopsy told the whole story. A cholesterol plaque in his left anterior descending artery had ruptured, a clot had formed and blocked the vessel, and his heart had gone into ventricular fibrillation. The left anterior descending artery supplies the large front wall of the heart, and blockages there are so lethal that cardiologists have an informal nickname for them. The Widowmaker, Tim Russert, went from working to gone in the space of minutes. His case teaches several uncomfortable lessons. First, managed risk is not eliminated risk. He was doing everything right, and it still happened because medication controls the disease. It does not erase the plaque already in the walls of the arteries. Second, a stress test measures blood flow through narrowed arteries, but it cannot reliably predict which plaque will rupture because the most dangerous plaques are often not the biggest ones. They are the unstable ones with thin caps, and those can sit quietly inside an artery that looks acceptable on testing. Third, and most practically, sudden cardiac arrest is survivable only when someone nearby acts immediately. CPR buys time. A defibrillator restarts the rhythm. Every public defibrillator you walk past in an airport or a gym exists because of deaths exactly like this one. So why does this matter to you, watching this right now? Because the heart attack itself is often survivable. Modern cardiology can thread a catheter into the blocked artery, open it with a balloon, and hold it open with a stent. And if that happens quickly, the muscle can be saved and the patient can walk out of the hospital days later. The entire outcome hinges on one variable, which is how fast you get there. And the single biggest delay in that entire chain is not the ambulance, and it is not the hospital. It is the patient, standing in a driveway deciding it is probably heartburn. Studies consistently show people wait hours after symptom onset before calling for help. And those hours are spent converting living heart muscle into scar tissue. If you take one thing from this case file, take this. You are not qualified to diagnose yourself during a heart attack, and neither am I. And I do this for a living. Chest pressure that lasts more than a few minutes gets evaluated by professionals. The worst-case scenario of calling an ambulance for heartburn is mild embarrassment. The worst-case scenario of not calling one is the subject of this video, which brings us to the warning signs card. Write these down, or better yet, remember them, because your hands may be busy. Sign 1. Pressure, squeezing, or heaviness in the center of the chest that lasts more than a few minutes, or that goes away and comes back. Sign 2. Discomfort spreading to the arm, the jaw, the neck, or the back, with or without chest pain, especially in women. Sign 3. A cold sweat with nausea, shortness of breath, or a sudden feeling that something is very wrong. The intervention, while help is on the way, and if you are not allergic, chew 1 full-strength aspirin, 325 milligrams. Chewing it gets it into your bloodstream faster, and aspirin slows the clot that is trying to finish the job. The number is 911, or your local emergency number, and you call it immediately. You do not drive yourself because, as we have discussed, consciousness during a heart attack is not guaranteed, and a car with an unconscious driver is a second emergency. If someone you know needs to see this, share it. Statistically, someone you know needs to see this. And if you want more case files just like this one, subscribe because Dr. Morbid is just getting started. Let us close the file. Myocardial infarction. A plaque ruptures, a clot forms, heart muscle begins to die on a schedule, and the electrical system can fail without notice. The warning signs are quiet, the window is short, and the most common fatal error is optimism. Your heart has been working for you every second of your life without ever asking for anything in return. The least you can do is take its one complaint seriously. Case closed. I will see you at the next one. Statistically speaking, I will see some of you sooner than others.